Welcome to the Life After Whipple Project. I'm Greg Adams, a pancreatic cancer survivor and current team leader. Everyone who gets a cancer diagnosis, as well as their family and friends, must deal with the fear and anxiety that this diagnosis brings. Well, tonight, Dr. Kellie Martens, a clinical health psychologist in the Psych-Oncology department at Henry Ford Health, she'll discuss how this disease and its treatments can affect us and present strategies for dealing with them. Kellie, I'm going to turn it over and let you take it from here.
So thanks so much for the introduction. As Greg said, I am a clinical health psychologist at Henry Ford Health in Psych-Oncology. I work really closely with Dr. Kwan and the pancreatic team. So I'm really humbled and pleased to be here tonight to talk to you about this really important topic, coping with fear and anxiety, specifically in terms of coping with fear of recurrence or disease progression. Okay. Throughout the talk, I'll try to elicit for some feedback, or, even if you're just thinking, oh, I have something to contribute here, feel free to speak up or raise your hand if Zoom lets you do that, and we can, hear what you have to say. I don't want this to necessarily be me just talking at you the whole time. Okay. So first of all, let's just define some things. What's fear of recurrence? What's fear of disease progression? So, fear that your cancer could come back in the same place or another place when there's been no evidence of disease is considered fear of recurrence. Fear of disease progression is concern or fear that your cancer could get larger or spread somewhere else when there's not necessarily been a period of remission or absence of disease, but maybe there's been a period of stable disease. So today I'm going to mostly try to use the phrase disease progression, fear of disease progression, but really I'm just going to use them interchangeably. Fear of recurrence and disease progression is really a commonly studied concept in the oncology literature, but was only recently examined specifically in folks who have been diagnosed with pancreatic cancer. So a recent study out of the Netherlands examined fear of disease progression among those diagnosed with pancreatic cancer. The study included 315 participants, and all those folks were diagnosed with pancreatic cancer between 2015 and 2018. 55% of them were male, the median age was 66, and just over 1/3 of them underwent surgical resection of their tumors, such as the Whipple. 44% underwent palliative chemotherapy, meaning chemotherapy with the intent of managing symptoms and hopefully reducing disease burden. And then the remaining participants did not undergo any forms of active treatment, but were engaged in what they called supportive care. So all participants were given self-report measures looking specifically at worry of disease progression, quality of life, and other patient characteristics. They were given the questionnaires right when they were diagnosed, and then again at 3 months, and then again at 6 months, and finally at 9 months after diagnosis. So it's not a very long-term study, but at least it is longitudinal, looking at how things sort of changed over time. So compared to people who were in the palliative chemotherapy group or supportive care groups, those who underwent surgery, such as the Whipple, had significantly lower worry of disease progression scores at the time of diagnosis compared to those who were in either the palliative chemo or the supportive care groups. Among all groups, though, if you compare fear of disease progression to other types of cancers, the scores were higher. Okay. The takeaway from this is fear of disease progression, fear of recurrence, these are really normal responses to people who have been diagnosed with cancer in general, but perhaps even more salient and meaningful for folks with a history or a diagnosis of pancreatic cancer. So, this is life after Whipple. So feelings after surgery. And I have some things that I've heard from folks up on this slide, and I'm not sure, Greg, I know a little bit about your history. I'm not sure about the other folks who are on the meeting. But if anyone wants to speak up to if you underwent surgery, what that felt like afterwards, what sort of emotions were going through you?
When I was in that boat, I remember a flood of feelings. And one of them was that I had no control, that the disease was just running the show. And like in many of the relatives of mine that had passed from it, there were no options. And particularly in the first few months of my journey, I was not a resectable candidate. So I knew that palliative care was a very likely end result. But I was lucky. I ran into a number of people that kept suggesting, well, you can increase your odds if you do this, it may only be a small amount, but these things add up. And I began to realize that there were a lot of things I could do that could change the trajectory of my diagnosis and prognosis. And so I kind of diverted my focus on the fear and anxiety to things that I could do that would keep me busy and my mind occupied. And things like visualization. I would, as I was going through chemotherapy, I would sit in my chair and visualize the chemochemicals, flying through my bloodstream with laser guns shooting the cancer cells. And it not only elevated my mood, my attitude, it made me feel like I had something I could do, that the disease wasn't totally in control anymore. And I just kept adding to that over time.
So I heard a lot of really helpful things there. First of all, in terms of your emotions, you said there was a flood of emotions. So, I think it can be a lot of different emotions surging through you from one moment to the next, which is kind of overwhelming. I heard certainly some feelings of like helplessness and dread, and some of that related to, it sounds like what you'd seen other family members go through in the past. But there was also a sense of, you said I was lucky. So there's also a sense of like being grateful that, you were able to undergo surgery and have this intervention. And then you got ahead of us and started talking about the way that you coped and really channeling all those feelings into like, what do I have control over here? And I love that you said that, because that's exactly something that we're going to talk about later. So I want to come back to that.
Okay.
Thank you so much for sharing that. Does anyone else want to share, if you had surgery, what the emotions were like afterwards?
Can I speak?
Yeah.
Can you hear me?
This is Jody, right?
No, this is Diane.
Oh, okay. Oh, I see. Okay. Yeah. It's hard for me to tell who's talking. Thank you so much, Diane. Please, yes.
Sure. And you mentioned after surgery, which is true, but they're there too. But before surgery, I was really anxious. I didn't know if I should even have surgery. I didn't know if I could withstand the surgery. What would my life be like after the surgery? Because you hear all kinds of stories and you read a lot. So it's really, where I went, they had a full team of people that, including psychologists who could, just kind of help me, saying we can control the anxiety. And my other choice, if not surgery, there wasn't much of a choice. You know, there was a time limit on getting up in the morning and saying, well, maybe 6 months, that's it. So I knew I had to get my emotions under control. I wanted to have the surgery. I owed it to myself and my family. And then after the surgery, I felt like, and it was rough, but I felt like a born again Christian, I think, because it was a relief. I mean, it was very uncomfortable physically, but
Yeah.
mind, it was like that first part of that anxiety, all those months before, and with the chemo, I felt like I had a new lease on life. God was very good to me, and so was my surgeon. So, but then, and then you feel like that for quite a while. Now I'm 3.5 years past the surgery, and I'm still very grateful. But it's like I need this again, because now you get anxious because, well, CAT scan's coming up, you
Yeah.
know. It can come back. You've been told it can come back, even though you might have a 3-year window, a 5-year window, but there's
Yeah.
always a little bit, you know?
Yes.
So
Yes. Thank you
that,
so much for sharing that. That makes a lot of sense. And, something that I hear from people really frequently before surgery, and the way that it's presented to you, I think it's a very daunting idea. And you're
yeah.
thinking about, how much your life is going to be changed. But again, it comes back to, and you sort of said, I had no other choice. It is a sort of, it's simultaneously a helpless and empowering feeling. Like, I have this choice, I can do this, but really, I don't have that many choices at the end of the day. So that's simultaneously, I think, helpless and empowering. And so you also mentioned, the anxiety going into surgery about whether or not you would be able to, whether your body would be able to handle that.
Mhm.
And then afterwards, the relief, right? So this is really common that, like, right after surgery, there's this initial period of relief. Like, oh, okay, I was so worried about just getting through this, and I have made it through this, and I know there's a long road ahead, but at least I'm on the other side of this surgery, and I'll figure out what my new normal is here, and
Mhm.
that can be a great place to be. But unfortunately, we don't stay there very long because the anxiety and the fear often creeps back in. So research with cancer survivors in general suggests that, interestingly, distress usually increases immediately after treatment completion. So if you've had surgery, you've finished chemo, and now it's time to just sit and wait, in general, that actually increases anxiety. And it's confusing for people because up until that point, you think, well, this was the goal, wasn't it? Like, this was the end game. But early on, you're literally in survival mode.
Yeah, I noticed that I got so busy just taking care of all of the side effects
Yeah.
from the treatment and surviving the treatment. It takes your focus off of the future for a while. So you're so busy that it seems to reduce the anxiety and the fear a little bit. But when the surgery ended and we completed the last of the chemo and I was starting into recovery mode, everybody said, they packed up their gear and they says, okay, time for me to go home. Surgery's done.
Right.
You don't
See
need
you
us
in 3 months.
anymore.
Yeah.
Yeah. And then you're kind of left there standing.
Yeah.
But then the next CT scan starts to approach and you start looking for your shoulder thinking, oh my God, is now when it starts coming back.
Yes.
And then the fear and the anxiety tend to return. And both before my surgeries and after, I reached out to another psychologist or psychiatrist at Henry Ford, one of your predecessors, Ellie, and she was extremely helpful. Really helped me keep my head on straight, taking, one day at a time, sometimes just 1 hour at a time.
Yes. One moment at a time.
Starting to build plans. When I got the cancer diagnosis and I realized how serious it was going to be, My original doctors told me that there's no chance. You have less than 1% chance of making it to Christmas that year. So I ended up shutting my company down and getting all the financials and the will and directives and everything in place and in order. But after 2.5 years, and I survived everything, and I'm sitting there, looking at, okay, what do I do with my life now? I've got to reinvent myself all over again.
Right.
So I hung the shingle back out and, went back to work, but at a reduced level. Again, I'm adapting to what remains of my ability to function today. And absolutely no complaints, because I just finished 6 out-of-state trips this summer, to catch up with all the relatives and the reunions and weddings and anniversaries that we had missed for 5 years. And that has been really great.
Good.
But
Right. So this is a part of the sort of adapting to a new normal. And I think what can be challenging with that is this diagnosis comes along and things happen really, really fast, right?
Yeah.
It's like a whirlwind out of the gate. So
Right.
all of a sudden it's one test after another, it's one treatment after another, it's all the appointments. Obviously you can't, work through that if you were working to begin with. And so everything becomes about like, just again, survival mode, just getting through treatment and the next step. And then all of a sudden, when that comes to a halt, it's like, well, now I'm not working. And I still have appointments, certainly you still have appointments. You're still dealing often with the physical effects, especially if we're talking about Whipple and, all the gastrointestinal issues that can follow from that. So you're still dealing with all that, but all of a sudden, like, you have time on your hands. You don't have as much support. You don't have as much reassurance from the appointments. Right. All of a sudden now you have these scans at whatever routine interval, oftentimes, that may mean without any active treatment, and you're just waiting. Right. So it can be a very helpless feeling. I think we can conceptualize fear of recurrence or disease progression like a life stressor. So we already have life stress. It's not like we're all just living these super easy lives with no problems, and then cancer comes along and ruins it. No, we have lives, we have stress, we have relationships and dynamics there. We already have hard stuff, and then cancer comes along and throws fuel on the fire. So, certainly there's coping with the physical effects, fatigue, potentially diabetes, potentially intolerances to certain food, ongoing pain, financial stress, whether it's due to, missing work or medical expenses. Certainly there's no way to face a diagnosis of cancer and especially pancreatic cancer and not be confronted with thoughts about mortality. Trying to focus on quality of life with whatever time that is. These are really, really heavy things to think about. Right. And so these may be new life stressors. They may be life stressors that, again, just exacerbate things that were already going on. If there were already relationship difficulties, and then you throw this intense stress of an illness on top of it, that can take a toll on your relationships. It can lead to change in roles in relationships. So common that the people I meet with tell me, like, well, I've always been the one who takes care of everybody else, so I don't know what to do here. Like, I don't know how to adapt to this role of being the one that's needing help from others. Okay. So if we conceptualize fear of recurrence or progression as a stressor, we think about how do we typically respond to stress? What are potential responses? We might have anxiety or worry. We might develop depression. We know that rates of depression among folks going through pancreatic cancer are higher than that compared to other cancer types, and even that depression seems to start to occur before the actual diagnosis is made. There's actually some biological component that leads to depression going along with the cancer and perhaps the physiological effects. We might become angry. We might isolate from others. We might engage in maladaptive behaviors like drinking alcohol or overeating or smoking, maybe risky behaviors, or just generally not taking care of ourselves. Maybe it's not anything that huge, but we might just engage in escape or avoidance and try not to think about it. I just want to not think about this. I don't want to deal with it. I don't want to face it. Maybe that just means sleeping a lot. Okay, some denial, perhaps. So anytime that we're facing a stressor, I think the first step is to recognize that we are stressed. So that looks different for different people, right? How do you know when you are stressed? For one of us, that might mean, okay, I notice I'm not sleeping well. I notice I'm thinking about this thing that's bothering me a lot. For someone else, it might mean, oh, I notice I get kind of short fused and I'm irritable and I lash out at my partner or my kids. When we look at the stress that's specific to fear of recurrence or progression, this might be thoughts, feelings, physical sensations, and very specific behaviors. So thoughts of the what ifs, right? What if this next scan is bad? Feelings of being scared, anxious, nervous, watchful, on guard, sort of just waiting for the other shoe to drop. People will describe it like that. We can feel stress and anxiety and fear in our bodies, right? Commonly, people will feel like their heart's racing, their stomach's upset, they might have headaches, they might notice they're very tense and, holding our shoulders up to our earlobes, very tight and tense. Again, behaviors might follow. So avoiding difficult emotions, engaging in behavioral avoidance, avoiding things that make us think about our illness, avoiding and talking about it. Frequent checking or like the need for reassurance. So, frequently reaching out to your doctor and needing reassurance about, whether it's your scan or whatever the last test was. Not all of this is negative, right? Some of this is being, just mindful and engaged. This isn't necessarily like these are bad things. This is just tuning into, what are my habits when I start to be fearful or anxious? What comes up for me? So the next step is, all right, I've noticed that I'm feeling this specific stress, this fear and anxiety. How do I manage it? What do I do about it? So, once you've noticed it, one thing we work on in therapy is called cognitive behavior therapy, which essentially means identifying if we're having some sort of distorted thoughts, and I'll explain what that means, and changing them, okay, so that they might be more accurate and less harmful. We can work on eliminating or reducing controllable stressors. And so, both Greg and Diane mentioned working on controlling their emotions, because that felt like something that was within their control, controlling emotions or your attitude, your response to this cancer diagnosis. We can engage in enjoyable or pleasurable activities. This is not always easy when you're not feeling well and your body is telling you, I can't do the things that I used to do. Well, I used to enjoy golfing and I can't do that right now. So I always tell people, as much as you can, find things that make you feel like you. Engaging in relaxation exercises or mindfulness. And so, Greg, you mentioned like visualization, that you would do during chemo. And this speaks to that as well. Visualization and mindfulness can be a really powerful tool to transport us somewhere else. So I mentioned that one of the things that we do in therapy when we're working on anxiety or fear would be cognitive behavioral therapy. So the idea behind this is kind of, it sounds kind of technical, but at the end of the day, it's pretty simple. The idea is just the way that we think influences the way that we feel and the way that we behave. So when we are looking at something like fear of recurrence or progression, oftentimes there's some sort of triggering situation. It might be a physical symptom. I have a stomach ache. That stomach ache leads to a thought. Oftentimes, once cancer is in the picture, that thought is, it's my cancer in one way or another. It might be a headache. It's, oh, the cancer has spread. It might, whatever it is, oftentimes it's very common for those physical symptoms to trigger these sort of catastrophic thoughts about illness. So if that's the thought that we have in response to a stomach ache, that understandably leads to feeling nervous or scared. It might impact our behavior in that we, get really upset, we cry, we call our doctor. Maybe we avoid doing things because we think, well, what's the point in doing anything that's going to bring me joy? Or what's the point of going to work today if my cancer is progressing? We might feel this in our bodies too. Some of the same things that I talked about earlier, increased heart rate. Maybe we feel even more nauseous because we're thinking about it and we're focusing on it and we're catastrophizing it. Actually worsens the symptoms. We know that in general, we all engage in distorted thinking. Okay, it's just human nature. We have these thoughts, they're automatic, and sometimes they're not very accurate. So I'm going to give a really benign example that has nothing to do with cancer to show you that we've all been here. Okay, we're at the grocery store. We pass someone that we know. We say hi or wave, and that person doesn't look at us and they just keep on walking. There are a lot of different ways that we could interpret that response. There are a lot of different thoughts we could have about that situation. And depending on how we think about it, we're going to feel differently. So we might think, oh, they didn't see me. Okay, well, if they didn't see me, then I'm not too worried about it. My feelings aren't too hurt. Or I don't know, they seem distracted. They were busy with their kids, whatever. Okay, I'm not too hurt about that. But if we think, oh, they're mad at me about something, right, that's going to cause a different emotion. Or we think, they must not like me anymore. I don't know, right? It's going to cause a different emotion. It's going to cause a different response, and it's going to sit with us differently. So that's a really benign example of how we all engage in certain thought patterns, and sometimes the way that we think is not real accurate. This is called distorted thinking. So there's common types of distorted thoughts that we use, and I've given some examples of them here. So we'll start with one that's all or nothing thinking. This is also called black and white thinking. In the white boxes, there are just very general examples of these. So like, if I'm not perfect, I failed. Either I do it right or not at all. So very black and white, very all or nothing. You're all good or you're all bad. And then beneath the white boxes, I've given examples that might pertain more to a cancer experience. So I will only go back to work when I can give it 100%. So it's very all or nothing. If I can't give it my all, I'm just not going to do it. Right? So Greg, you already said that you didn't do that. When you ultimately decided to go back to work, you adjusted your schedule so that it felt manageable for where you were at. But you can see how that would be problematic if we have that type of mindset, because then that often leads to just not going back to work and not getting into, more of a routine. Another common distorted thought is, overgeneralizing. So everything is always rubbish. I don't know where that must have come from in English or British example, but nothing good ever happens. So basically some bad thing happens and then all of a sudden everything is bad. Okay. So an example pertaining specifically to cancer is, okay, well, now that cancer has been in my life, people are only going to see me as a cancer patient. They're not going to see me as me anymore. Okay. Another example of a distorted thought would be disqualifying the positive or only focusing on the negative. So, let's say we just finished surgery, scan came back good. Well, that doesn't mean anything because I just had surgery. So of course it's going to come back good. Okay. Another example is of a catastrophic thought is catastrophizing. This is probably one of the most common, blowing things up, worst case scenario. Okay. The stomach ache means my cancer is coming back. That's the example I gave earlier. Shoulds or musts. Well, I should feel better now. I should be able to go back to work full time. I should be able to do all of these things with my family. I should be able to put this behind me now because my scan was fine. I shouldn't be bothered by this anymore. These are a lot of common things that I hear. Okay. And then the last example of a distorted thought is jumping to conclusions. So this is, you might also consider this like mind reading, where you think you know what someone else is thinking, and then you act accordingly. So, well, my family all expects me to be strong, so I can't tell them that I'm actually struggling. Were there any questions on that? I know it's kind of a busy slide with a lot going on. No? Okay. So how do we respond to this? First thing, again, just like noticing that you're feeling stressed is sort of the first step in being able to manage that. You're noticing that you're feeling fear. You're noticing that you're catastrophizing. Once you notice it, you can catch it and perhaps change it. So if the situation is, I have a stomach ache, rather than the thought being, this is my cancer's coming back, the thought might be, this could only be a stomach ache, and I'll call my doctor if it doesn't get better. I guess you could call your daughter if it doesn't get better too. So the idea is not just, I just want to make sure it's clear, the idea is not just to think positive. It's not just like rainbows and unicorns, don't worry at all. It's just to take that catastrophic worst case scenario and consider what is perhaps another explanation that is potentially more feasible or at least more helpful for you in this moment. So it's not worst case scenario and it's not best case scenario. It's just, what is something in the middle that feels reasonable that I could actually believe, right? So notice I'm not telling you to just go, well, it's just a stomach ache, I'm not going to worry about it. This might just be a stomach ache and I'll call my doctor if it doesn't get better. You could see how that thought might lead to a little less anxiety. Mm-hmm. It's not no anxiety, it's just at least a little less anxiety. So it's not quite so heightened. Maybe in response to that thought, you would, just kind of rest, take it easy, monitor your symptoms, but you wouldn't do anything rash or jump to any conclusions. And then what's interesting is we can also see that when we do this, when we change the way that we think about, especially physical symptoms, it can actually lead to changes in our sensations or our perception of those symptoms, right? I don't know if any of you have ever just like sat around when you're in pain and focus on the pain, but boy, it makes it bigger, right? Mm-hmm. And so if you change the way that you think about it, it can actually change the physical sensation that we're experiencing. Maybe the stomach ache will improve because we're not focusing on it so much. Okay. So I just walked through sort of the cognitive behavioral model that we do in therapy and we're working on, like anxiety and fear. And I walked through how sometimes our thoughts can be distorted, meaning they're not realistic. We can jump to conclusions, we can catastrophize. But here's the thing. Sometimes our thoughts are not distorted when it comes to cancer. Sometimes the thought, my cancer could come back, it's not helpful to try to change that, because that is a valid thought, right? I already heard from, you, Greg, and you, Diane, that the initial prognosis and what your doctors were initially telling you is really grave and serious and scary. So it's invalidating sometimes to say things like, oh, don't worry about that. You got to think positive. That won't happen. Right. So when your thoughts are not distorted, when you're looking at it and you're going, no, really, that's valid. Like they told me my, chance of recurrence is X%. This isn't a distorted thought. This isn't an unrealistic thought. This really could happen. We work toward acceptance. So rather than trying to change the thought itself, we work toward trying to change our relationship with that thought. Changing the control or the power that the thought has over us.
Well,
What is
that
that?
it's a thought that I had to deal with a lot, and I'm watching other people who've come up behind me deal with it as well. And I know one of the scary things post-surgery is you get about a year to a year and a half away from the surgery, and scar tissue begins to show up as false positives in your CT scans. And that happened to me. And it was kind of a surprise. I wasn't anticipating it. But since then, almost everyone I have talked to who has, who is that far out from their surgery have had the same things happen, where scar tissue begins to hold the dye, shows up as a false positive. They're scary. So it's kind of like a fire drill that you go through. The radiologist will flag it and say there's a possibility of metastatic recurrence.
Oh gosh.
Then you've got to go get an MRI to sort it out, to determine if it was cancer or just scar tissue. And but you never get away from it. And I think one of my mentors was Sheila Castleman, Ellen's family member that with the Sky Foundation. And she helped me get through those early bumps and grinds. And she had been cancer-free for, I think, 17 years before hers did return. And so she had one of the longest runs that I know of. And so she helped teach me how to deal with that what if, or, the recurrence issue.
So what were some of the gems that you got from her that helped?
Again, it was learning that there are things you can control. However, when pancreatic cancer does return, if and when it does, your options are significantly less than they were the first time around, because the cancer doesn't respond as well to treatment as it did the first time. And quite often when it does show up a second time, it's in a different location because all of the normal organs for pancreatic cancer are now gone.
Removed, yeah.
You get it in your lungs or someplace else where it's more difficult to treat. But it's a thought that never goes away completely, but you have to learn how to adapt to it.
Yes.
Let it control your life. I do know someone that is really struggling with this, even though he has had 3 cancer-free CT scans since his surgeries and is doing quite well. But every little bump and hiccup, it just scares the daylights out of him that the cancer is back. And it's become a significant focus in his life. But,
it can become so consuming.
Yeah, I'm working with him. He now has counseling, and I've helped him get into that. So
good.
He's making progress. He's back at work, which I think is one good thing. It's taking his mind off of thinking about it all the time.
Yeah. Absolutely. A little bit of healthy distraction. And again, just doing something that makes you feel like you.
Yeah.
Because when you're sitting around with too much time on your hands, it's inevitable that your mind is going to wander to this place. And you're right, these thoughts are always going to be there. That is not, that's where I'm saying it doesn't make sense to try to change that or stop that thought. In fact, when we know is when we try to stop thoughts like this, over time, it kind of makes the distress associated with them grow stronger. And so the better thing to do is to recognize, okay, I'm having that thought, right? But just because I think it doesn't mean it's true. So it might mean is something as simple as like when you tell yourself, my cancer could come back, or what if my cancer is back on this next scan? It might mean something as simple as saying, my mind is telling me that my cancer could come back. So see how it sort of detaches you from the thought being like the thing that's going to happen, the reality. Just because we tell ourselves it could happen doesn't mean that it will. Okay, I'm having the thought that my cancer could come back. And so it's not changing that thought, it's changing our relationship to it. And then exactly what you said, Greg, focusing on what you can control and what you cannot control, right? Being able to let go of those things that we don't have control over. I'm now going to segue into my next busiest slide, but I like this because it really can be used for any sort of stressor in life, but it certainly works well for the fear and anxiety that goes along with cancer. So basically, we've got it broken down here in terms of two different types of coping that we could use. We can either use problem-focused coping. This is for when the stressor is controllable, or we can use emotion-focused coping for when the stressor is uncontrollable. The reality is any given stressor is going to have controllable parts and uncontrollable parts. So let's just use this as an example. So what is outside of your control when it comes to cancer?
Reoccurrence.
Right.
Yeah. I mean, ultimately, like what that scan says is outside of your control, right? Like I think there are things that we can do that might increase the likelihood that we stay healthy. But ultimately, whether or not that scan says there's a recurrence is outside of our control. Absolutely. Anything else?
I've got a question.
Yeah.
Does medication play a role in any of this? Is
Like
there a
medication
benefit
for
to it,
anxiety?
or should you avoid it?
Like medication for mood or anxiety?
Yeah.
Yeah, I absolutely think it plays a role. Absolutely. Sometimes I'll see people who have no history of anxiety or depression, and we mention a medication. It's like, no, I don't need any of that. This is, of course I'm feeling the way that I'm feeling. And that's true. It's normal to feel a lot of this. It's normal to have sadness and the anxiety and all that. But sometimes medication is just, another tool in the toolbox or sort of a crutch to get you through. It doesn't mean you have to be on it for forever, but especially in these really acute phases of high stress and anxiety. Absolutely. I think that it can be helpful. Sometimes it just allows you to think clearly enough to then engage in some of these coping strategies when the emotions are so high that they're overwhelming. Yeah, that's a good question. And that could be something that's within your control too, right? So, I mean, I think in general, that would be one thing that's within your control is what medications you're taking. If you're taking them like your doctors want you to take them. What else is within your control? I can tell we have a group who's come to terms with like, okay, there's actually a lot that's still within my control. So I feel like we're going to get a lot of good responses here.
Yeah, I did try a medication, and unfortunately it backfired on me. I had an allergic reaction to it.
Oh no.
And ended up going deeper into depression than I was before I started it. So we backed out of that, and I just decided to do a lot of the cognitive behavioral approaches, adjusting my perception of the situation. And if you can get your perception altered into more of a correct path, correct direction, then your attitudes and behaviors tend to follow.
Yep. Yep, absolutely. I'm glad that that worked so well for you. And sorry to hear about the medication side effects. Certainly everybody's, body is different, and sometimes it's trial and error, which can be kind of frustrating. It's like, okay, we're going to try this one, this one doesn't work, we'll try something else. So it definitely takes some patience, but yeah.
And could I just add something too? I'm older, and all my life it's like, well, I can handle this. I am strong enough. I don't need that, just for the anxiety history. And then I came across pancreatic cancer, and I thought, no, I can do this. But then after the chemo and before the Whipple, I met something that I couldn't control. My anxiety was never at this level. And it was just while I was trying to make the decision about the Whipple. And I tell you, it was like I prayed every day, and God was good to me, because when doctor suggested something, I thought, oh my, but I tried it. And I'm telling you, that played a big role in me accepting. I mean, my anxiety was lessened, just like you said, doctor. I could think clearly. And it was all of a sudden like, this is a no-brainer. I have to go through with this, and then I trusted in God. I mean, I would just come back to that thought, but without that, I don't know if I'd still be spinning out there, and it did help. It really helped me get the courage, if you want, or lessen the anxiety. So I was looking forward. In the morning of surgery, I didn't know how I was going to sleep the night before even, but everything fell into place because the medicine started about a month before the surgery. And that convinced me that it's okay, Diane. It's okay to do that.
Good. I'm so glad that you allowed yourself to use that tool when you needed it.
Right.
The thing is, you never needed anything like that before because you were able to manage normal life stress.
Right.
This is not normal life stress.
No.
So,
I thought I had all my tools that I had acquired, without education in my lifespan. And just like you said, I finally admitted to myself that I can't do it alone. I'm without that medicine. What have I got to lose? So it was very, it took me a lot to get to that point, right? Pancreatic cancer, but I accepted the fact that I've got nothing to lose and I'm going to try this. It's not a bad thing.
Yeah.
The medicine.
And, I think for most people, when the emotions are so overwhelming that, like you're saying, you can't think clearly, you can't make decisions. When you find the right medication, it can make you feel more like yourself, right? People are worried, well, I don't want to take a medication. It's going to numb me or make me feel like someone else. Or when you find the right one, it makes you feel more like you. It makes you feel like, okay, I can think clearly. I feel like me again. So, but obviously it's a case by case basis, and you gotta work with your doctors. If you have a psychologist or a psychiatrist who can, see you through that, that's good. But
Gotcha.
I think there's absolutely a role, just depending on the person and certainly your body and your medical history. I don't want you, trying a bunch of things if you're allergic to them, but
No, no, right.
but
Mhm.
okay. So this, basically this slide points to any given stressor. There's things that you can control. There's things that you cannot control. For the things that you can control, do something about them. So when it comes to your health, this means, active or adaptive ways of doing what you can control would be seeking information from your doctors, setting specific goals for yourself. Maybe that's health related goals. Maybe that's goals to just, prioritize spending time with your family and things that you value. It's working on relationships. It's requesting support and help if you need it. It's if you're looking at things that are outside of your control, it's working on how do I then manage the emotions that go with all of the things that are outside of my control.
Mm-hmm.
So coping with emotions means reappraising the situation or changing the way that we think. We talked about that, reframing our thoughts. It might mean physical activity, massage or acupuncture, meditation, relaxation, the visualization that Greg mentioned. It might mean just expressing your emotions and getting them out so that they don't, build and fester and then, boil over eventually. That could mean talking with others, but maybe it's not talking with others. Maybe it's journaling or writing poetry or doing art. We even have art therapy at Henry Ford, and it's a nice way of expressing what you're feeling. Also just accepting your emotions for what they are. So again, not, invalidating what you're going through and recognizing like, this is not a normal life stressor. I always tell people, when you are feeling overwhelmed and like you just don't know how to move forward through this, that's a really normal reaction to an abnormal situation. The situation is abnormal. Feeling overwhelmed with it is not. So these are in contrast with maladaptive coping behaviors that people might do, like complete avoidance or denial, overeating or smoking or drinking, not taking care of yourself, not going to your appointments because I don't want to hear what they're going to say. We want to use active, intentional ways of coping, both with what we can control and then also the emotions that arise in response to all of the things that are outside of our control. So we've talked about this specific to coping with, cancer and recurrence, but again, I like this because it actually works with any stressor that you're facing, in your day-to-day. You might say, okay, what part of this can I control and what will I do about it? What can I not control and how do I manage the emotions that result from that? Mm-hmm. So social support, I think, is also really important. And I want to make sure that we spend a little bit of time just talking about that. I think people who have strong support certainly have an easier time going through this. People who don't, it's really hard. You need support. I mean, you need physical support, but you need emotional support. So it's important to know who you can ask for support, but also how to ask for support. Sometimes we have people who are just really good at anticipating our needs and they get it. Maybe they've been through something like this before and they step up to the plate and they knock it out of the park and they just know, they just know what we need. But oftentimes people don't, right? And so we get a lot of different responses where people will, I don't know, they'll fall off the face of the earth. They'll say things like, let me know if you need anything. Okay. They'll try to give you advice when really what you need is just, a shoulder to cry on, or they'll, basically people are not always great at matching the type of support that we need with exactly what we need. right? So I think what can be helpful is look at your support network and take stock of who is probably best for which type of support. So you might have a friend who is the person who is just like, positive Pollyanna. And maybe sometimes you need that. But maybe sometimes that's invalidating. So you might say to yourself, okay, what do I need right now? Do I need someone who's going to be positive Pollyanna and tell me, don't worry, you're going to get through this, you got this, you're strong? Or is that going to feel invalidating to me in this moment? Do I need someone who's going to say, hey, it's okay to fall apart a little bit right now? Do I need that person who always gives me advice in this moment? Or do I just need someone to listen to me? Do I need tangible support? Like Aunt Fran is a really good cook, so I'm going to tell her that I need some meals and what the parameters are around what I can eat and what I cannot. So-and-so has more flexibility in their schedule, so I'm going to ask them for a ride to this appointment, right? So looking at, do I need emotional support? Do I need informational support or advice? Do I need just tangible, concrete support like meals or rides or what have you, help cleaning the house? And who is strong in those areas that I can ask for those specific types of support from? Think about ways to increase your social support groups, obviously. That might mean professional therapy or counseling, because that is an arena where you can talk about whatever is on your mind without any concern for how it's going to impact the people around you. Right? This doesn't just take a toll on the person who's diagnosed. It takes a toll on everyone who loves them. And sometimes it can be hard because we want to protect the people who love us and we don't want to burden them. So having a safe place to just put it all out there can sometimes be very helpful. Maybe increasing your social support looks like meeting people who aren't in the cancer world, and just trying new hobbies or activities or classes. And I always remind folks that quality is more important than quantity, because I think in this day and age where we have social media and 300 friends, and it seems like everybody else is so happy and everybody else gets more likes and everybody else has more support than us. It doesn't matter if you have 300 friends. It matters if you have 2 really good ones.
Yep.
Yeah. That was like an amen. If you're spiritual or religious, we know that spirituality and religious behavior is associated with better health outcomes. And the research shows that it's not just a function of social support. Like, it's not just I have more friends because I'm a part of a church. It's also, I think, an element of it's an element of acceptance. It's an element of being able to say, okay, if this is not within my control, I do everything that's within my control. And at the end of the day, whatever is not within my control, then I give that up to a higher power. We also know that a lot of activities that go along with religion and spirituality are similar to some of the things that I talked about, like relaxation exercises or meditation. There can be benefits to that. Information seeking. So, one of the things that we have control over is how we advocate for our health. Developing a partnership with your doctor. It is okay to get second opinions. It is okay to find someone who is the right fit for you and your personality and your communication style. You need to be able to trust that person. Ask your doctor the questions that you need to know. And everybody is different in terms of how much information we want, right? So some of us are going to show up for that first appointment with a notebook ready to vigorously take notes. And we want to know all the percentages, and we've already Googled it. And some of us are like, I don't want to know all of that. Do not give me all of that information. You just tell me what the next step is and I will do it, right? So you have to know yourself and what type of care you want, what type of personality you are as a patient. But we are our own best advocate. Entering into the survivorship phase, we should be receiving a survivorship care plan. So what does my routine follow-up care look like? How often am I having scans and for how long? How often are my appointments? What medication should I be taking? What do you recommend in terms of diet? What do you think about drink and alcohol? All that. Ask them, what are specific symptoms I should look for that I should be concerned about? Remember that not every ache and pain is cancer, but if there's something that they've said, hey, if you experience this, this is a concern, I want you to give us a call. We want to know that. If you are someone who likes to Google and information seek on your own, make sure that you're looking for reliable sources of information, because there's so much information out there and it's really hard to sift through what's reliable and what's not. A really good just lay person source is the Mayo Clinic. That's usually one of the first results when you Google, but it tends to be pretty good in that, it's reliable, it's in layperson's terms, but be careful about going on blogs and websites and, Joe Schmo's cancer page, because there's so much out there that's not always reliable. If you're reading something that's not consistent with what you've been told by your doctor, take note. Your next follow-up appointment, say, hey, I saw this. What are your thoughts on it? Okay. Advocacy is important. So when should we seek professional help? This is when we're having anxiety or mood or depression symptoms that are starting to interfere with day-to-day life. They're having an impact on our relationships. They're interfering with our day-to-day activities, our ability to work, our ability to take care of things around the house, our ability to get enjoyment out of life, our ability to take care of ourselves, take our medications, making our appointments. Obviously, if you're ever feeling hopeless, if you're ever having suicidal thoughts, any of these concerns would warrant talking to your doctor. As we wrap up, I want to talk about, are there positives? Because I think we talk a lot about the challenges and the negatives that can go along with a cancer diagnosis, and especially one that, is as serious as pancreatic cancer. What the research shows is that there are positives that can come from this, that some people report. What was that?
Oh, I was being prompted here to read.
Oh.
I was being prompted for him to read number 2.
Yeah.
Oh, oh boy. So, positive benefit finding, meaning we can find the positive or make meaning from going through an experience with cancer. We can actually say, you know what, this made me think a little bit about what really matters, what's most important. Okay. And for some folks, it makes them realign how they spend their time. So
I'd like to make a point on that
Yeah.
second bullet there, and Patty's correct. Getting a pancreatic cancer diagnosis just totally disrupts everything, that your life was going to be. And so you do have to reprioritize what's important. I mean, a normal part of aging, that's kind of normal. People forget to do it when they should, and life will smack them up against the back of the head and remind them, hey, you're not a young person anymore. But pancreatic cancer diagnosis is a whole different ballgame, where you're put in a situation where your life very likely won't be around, in a very short period of time. So you do have to reevaluate and reprioritize everything, finances, relationships, housing, everything. And it's not something that you do just once and make all the adjustments. It's something that you grow into, but it hits hard, and you have to be ready to address them. And I think that's where a lot of my anxiety and fear crept in, was well, what am I going to be if I do get to the other side of this thing? Who am I going to be? What will I be able to do or not do?
Mhm.
And again, that forced me to prioritize everything in my life. My goals, my hobbies, relationships, you name it. It affected everything. So yeah, I've had to set new goals. And then you reevaluate the value of what you've been doing and what you hope to do.
Yeah.
That's part of the reprioritization process as well. So yeah, this game isn't for sissies. It's not an easy journey, but it can be a good one. I think my priorities are much better and more properly aligned with my life than they were before, particularly with my caregiver here.
I force him into it, though. He has a tendency, and I think once you realize you are a survivor, okay, and that I would equate that not only to pancreatic cancer, but a survivor period of some major life process, okay, medical life process, then what begins happening, and I would share this openly because I'm sure other members have felt this, okay, your partner then they lived through a loss while they were so ill, okay, and so there's a tendency to want to reconnect or recapture everything that didn't happen during that time frame that you were ill, okay, and it's back to, I think it's a control thing because someone else is controlling that you go to chemotherapy in some respects. I mean, yes, you're a big part of that, but there's parameters. And so then suddenly what I saw with Greg was he let go of specific things. He let go of specific things pretty easily, but he quickly replaced them with some other things that were maybe too astronomical, okay, because he was so interested in getting forward, okay, and I think that may be nothing more than you're a survivor and you want to enjoy what you have to enjoy. So, but he has looked back, he's done better recently, he's done better, and of course I remind him frequently that that he won't be able to do everything that he always thought he was going to do within a lifetime, okay, because number one, he's older and wiser, but he can reprioritize about what it is he can do. And for example, he has always chosen a path of giving to others, and since his cancer diagnosis, I see him giving even more to others, and I feel really good about that. So his priority is, that's a number one priority for him,
Yes.
which is a good priority.
Well, clearly, this is something, this is an avenue in which he gives, right? You said so many good things. Where to start? So I think it is really normal when you are faced with a life-threatening diagnosis and you are looking mortality in the face to grieve. And I liken it to, you're looking mortality in the face, you don't know what the future holds, you are looking at a cement wall. When you're looking at a cement wall, it is only natural to turn around and look behind you. So what happens is we turn around, we look behind us, and we start thinking about, I should have done this. I should have spent more time doing this. I wish I would have lived my life like this.
So shoulda, coulda, woulda.
Shoulda, woulda, coulda, yeah. So, but then we get this new lease on life, and it's suddenly like, well, now I can do all those things, right? Which is a lot of pressure to suddenly fit in all the really important things that you were supposed to do in life. So
Right.
I think it's a positive that it makes you take stock of what's important, but also, you know, it doesn't have to be huge life altering change. It can be small things.
Exactly.
And you know, when you look at like, when you say, okay, I want to do something like, I don't know, I want to start a nonprofit for people going through pancreatic cancer. That's a wonderful thing to want to do, right? But then I might say, let's drill down and say, what's important about that? Well, what's important about that is I want to help other people who are going through this. Okay, well, I still think that's a great goal to work toward, but like right here and now, what can we do to help other people who are going through this? It might be just being a mentor. It might be, you know, so it doesn't always have to be something huge. You can still be what is important to you. You can still be you and your values without having to do all of the things. It's a focus on being rather than doing.
Right.
Right. So that's really normal. And I think, you know, again, this is the meaning making that comes from the trauma of going through cancer. In the literature, it's called post-traumatic growth.
Yes.
Go through a trauma and it forces you to grow. People who don't have a lot of distress or trauma associated with their cancer tend to not have much growth or benefit from it.
Right.
People who do have pretty significant distress or trauma from their cancer often have more growth and make more meaning out of it.
Now, you just mentioned something. You started to do the PTS, and I'm going to add the D to it.
Yeah.
I thought I had made it through all of the cancer treatments, the surgeries, and everything, and came out of it quite well. What I didn't anticipate was earlier this year I had to have a surgical procedure done. Normal thing, you go in, they do anesthesia, so you meet with the anesthesiologist, they put the cap on, you know, you're in the gown, and I went into high anxiety. Just surprised the hell out of me. I did not anticipate was going to happen.
Yeah.
The first indication was the heart monitor started binging. You know, a nurse came in and she saw my blood pressure was going through the roof.
That's the fear. Yeah.
Heart rate was way out of line. And she said, we're going to have to cancel the procedure. And I'm sitting there thinking, what is happening? And I realized it was post-traumatic stress disorder. I was flashing back to the 2 Whipple surgeries that I had to survive. And my anxiety just went out the roof. So I looked at the nurse and I says, no, we're not pulling the plug on this. I said, just give me 5 minutes. So I just went into a deep meditation and brought everything back under control again, you know. But that caught me by surprise. I did not expect that reaction. My brain just snapped.
Well, what a triggering situation after not, you know, having anything like that happen for a couple of years. That's incredibly triggering, and amazing that you were insightful enough to recognize what was going on.
Yeah.
Right.
And that you had, you know, that mind over matter ability to do some meditation, bring your heart rate and your blood pressure down.
Well, I had gone through PTSD counseling from Vietnam. I was I worked undercover in Vietnam during that era. And so I had a lot of PTSD issues from that I went through counseling for. So I just went back into the old techniques and brought my mind back to reality again.
And that's the thing is, you know, usually the things that are most triggering for us are the things that we don't expect. If you expect it, it's not as anxiety provoking, right? Because you're already looking for it and you know it's coming. It's that thing that catches you off guard that hits you hardest, I think. Thank you for sharing that. So I'll just wrap up. You know, I'm pretty much toward the end here. So basically, in summary, I just want to say, that this is a completely normal response. The fear and anxiety, especially after a diagnosis of pancreatic cancer, again, is a normal response to an abnormal situation. This is a really significant stressor. It's not a normal life stressor. It still looks different for different people. So you have to know for yourself, what is a sign that I'm overwhelmed? Like, what is it for me that I should be keeping an eye on? And then what can I do to manage those emotions or change the situation or cope with the problem? And, finally, again, to take a big step back, take stock over what is important to me, regardless of what the next scan shows. I will have this anxiety. This is, I sort of think of this like, the fear and anxiety are always going to be there. That's normal. It's like, rather than saying this is a ball and chain that holds me in place, this is a ball and chain that I'm going to pick up and carry with me while I keep living my life in a way that is meaningful to me, while I keep living my life in a way that's consistent with, who I want to be and what I value.
Mhm.
Okay.
All right.
Thank you.
Does anybody have any final comments or questions before we close?
This is Joe. I'm sorry I was late. My flight got delayed.
Oh,
So
hi, Joe.
I'm at the airport, but I was wondering would we be able to get a copy of the slides since I missed most of it? Would that be possible?
Yeah, I can
All right.
send those to Greg, and then Greg, if
Okay.
you wanted to send them
Right,
out.
I can distribute them. Yeah.
That'd
Sure.
be great, Greg. And
Yeah. And Joe,
I
let
read-
me see. To everyone.
Excellent, valuable information, Joe, that you'll be able to
yeah,
use.
I look forward to it because this is my third third disease with near-death experiences. So this is, I feel really, really lucky. And I've been through these three experiences, and I'm optimistic that I'm going to beat this thing. I'm 2 years post-diagnosis, and I've talked to a lot of people that are 10, 15 years post-diagnosis. So I am fired up to beat this darn thing. So I hope everybody else is too.
Yeah, I just celebrated my 5-year anniversary.
Super. Congratulations, Greg.
Yeah,
Congratulations.
It
That's
was
awesome.
after stage 4. So I just put my email address up on the chat.
Okay.
So if you can capture that.
Yeah, great. I was stage 1, so I'm really, really lucky.
You
I
found
am
it
lucky.
a really good time.
Yeah.
The sooner the better.
Yep.
For quicker progress. Yeah.
Yep.
Yeah.
Glad you could make it, Joe. We'll get those slides out. And then
All right. Thank you.
I know Greg mentioned that the presentation is recorded and will be up on the website too.
Thank you.
Oh, great. Great.
Eventually. Yeah.
That's great. Oh,
Thank
that'll be
you
great.
for
All
your
right.
time.
Thank you.
Well,
Thank you, guys.
A very good presentation. Thank you.
Thank you.
Thank
All
you.
right.
Great presentation. Great discussion.
All
Thanks
right.
so much. Thanks, everybody.
Thank you.
All right.
And good
Meet
night.
you all.
Good night.
Good night.